Your genes and your medicine. What is pharmacogenomics? You probably know that your genes determine things like your eye color, height. But did you know they also play a huge role in how your body responds to medicine? This is the science of pharmacogenomics. Pharmacology, the study of drugs. Genomics, the study of genes. Think of it as personalized medicine. Instead of one-size-fits-all dosing, this test looks at your unique genetic makeup. It helps your doctor know which medications are most likely to work, which might not work at all, and which could cause harmful side effects. A powerful tool for safer, more effective care. The process is simple. It starts with a sample, usually a cheek swab or a blood draw. The sample is sent to a lab. Genes act like instructions. Some people break down a medicine very quickly. They may need a higher dose. Others break it down very slowly. Drugs can build up and cause dangerous side effects. Knowing this ahead of time prevents trial and error. It might be surprising to learn that most of us have at least one genetic variation that affects how we respond to common medications. In fact, studies show that over 95% of the population carries at least one actionable pharmacogenomic variant. That means a drug out there might not work as expected for most people. Yet testing isn't yet routine. That's a major gap in care. Patients are often prescribed meds without this info, which can lead to frustrating and sometimes dangerous outcomes. That's why your voice matters. You may need to bring up pharmacogenomic testing with your doctor. It's not questioning your doctor, it's partnering for personalized care. By asking for a test, you're protecting your health. While pharmacogenomic testing can be beneficial for almost anyone starting a new medication, it is especially critical for patients in certain areas of medicine. Heart, mental health, pain, cancer patients. For individuals with cardiovascular conditions, the stakes are incredibly high. Blood thinners like clopidogrel. Certain statins used to lower cholesterol. If your body can't properly activate a blood thinner, you could remain at high risk for a heart attack or stroke. Conversely, if your body processes a drug too slowly, it could lead to dangerous bleeding. A simple genetic test can help your doctor choose the right drug and dose from the start. Another area where this testing has a profound impact is mental health. Finding the right antidepressant or antipsychotic can be a long, difficult journey. Months, years, trying different drugs and doses, side effects like fatigue, weight gain, emotional numbness. Pharmacogenomics can help shorten this process. Many pain medicines, including some opioids, are processed by enzymes controlled by your genes. Poor metabolizers of codeine get little to no relief because they can't convert it to morphine. Ultra-rapid metabolizers can experience dangerously strong effects from standard doses. Knowing this lets doctors prescribe pain relief that is safe and effective, avoiding uncontrolled pain and accidental overdose. For patients undergoing chemotherapy, pharmacogenomics can be life-saving. Chemotherapy can severely harm healthy cells. Extreme nausea, nerve damage, life-threatening infections, organ failure. Many adverse reactions are linked to genetic variations that affect how the body breaks down chemotherapy agents. A pharmacogenomic test can alert your oncologist to a high-risk profile, adjust the dose, choose a different drug, plan for extra supportive care, potentially preventing a patient from having to stop a life-saving treatment. By asking for a test, you're helping ensure medicines match your body's unique blueprint and minimize risk. If pharmacogenomic testing is so useful, you might wonder why your doctor hasn't already ordered it for you. Its adoption into routine practice has been slow for several reasons. One of the biggest barriers is a gap in clinician education. The field of genomics is advancing rapidly. Many doctors who finished training more than a decade ago may not have learned how to order or interpret these tests. Institutions now offer programs to educate healthcare teams, but that information hasn't reached every practicing physician. Another significant hurdle is logistical. Often the test needs to be available inside the electronic health record, and many systems aren't set up to support it or display results clearly. Doctors also note some commercial panels omit key guideline-recommended genes, creating confusion about which test to order. Concerns about turnaround time and reimbursement also play a role. Coverage is improving for some gene-drug pairs, but many tests still face hurdles. Navigating those steps is a burden many clinics aren't equipped to handle, so they avoid ordering the test. Research shows most patients are willing to be tested, yet most have never heard about it from their providers. By asking for the test, you advocate for your health and help push the system forward. Bringing up a new topic like pharmacogenomics with your doctor can feel intimidating, but it doesn't have to. Approach the conversation as a collaborative partner in your healthcare. Share what you've learned and ask for their help in getting the best care. Prepare a few clear sentences before your appointment. This helps you feel confident and convey your request effectively. A kind, informed approach leads to productive conversations. A good opening might be, "Dr. Smith, I was reading about pharmacogenomics, how our genes can affect medications. I learned it can help predict which drugs will be safer and more effective for me. Since you're planning to start me on a new medicine for my heart, could we do one of these tests to help choose the best option? I'm worried about side effects because my mother had a very bad reaction years ago. Given how important this chemotherapy is, I want to reduce the risk of a severe reaction so I can complete treatment. Would you be open to ordering a pharmacogenomic test for me? Is this something we could consider before the new prescription?" By opening a discussion, not issuing a directive, you create an environment for your doctor to listen, ask questions, and collaborate. One of the most effective ways to help your doctor say yes is to make the process simple for them and their staff. Clinics are short on time. Reducing administrative work helps. Come prepared with reputable laboratories that perform this testing. Two of the largest and most widely used in the US are LabCorp and Quest Diagnostics. Your doctor's office will be familiar with these. The test can be done with a simple buccal swab or with a standard blood draw using a lavender top tube. Mentioning these specifics removes guesswork and prevents delays. Even more powerful is providing the exact test name or requisition code. Find the Pharmacogenomics or PgX panel page before your appointment and note the name and code. I've already looked it up. The test is called test name, and the code is code number. I have it written down. This can save staff significant time and reduce friction. You remove key barriers: which lab, what sample, which test. When you make it easy, it's harder to refuse. Be prepared. It really helps. After you get your pharmacogenomic test results, you and your doctor will have a detailed report to review. Your role as an informed patient doesn't end there. The Clinical Pharmacogenetics Implementation Consortium, CPIC, provides free guidelines translating results into prescribing recommendations. PharmGKB is a comprehensive database of how genetics affects drug response. Lab reports categorize medications. Use as directed, moderate interaction, significant interaction. Read the entire report and bring a copy to future appointments. I found a helpful CPIC summary that explains my result. I can print it for my file. You're proactive without overstepping. Never change medications on your own. Always consult your doctor. If your doctor says no, stay calm. It's often an opening for discussion. Listen for their specific concern. I understand there's a lot of new information. My understanding is that testing can prevent serious adverse reactions in cases like mine. Offer to call your insurer or the lab about coverage or self-pay pricing. Reiterate the lab and test code to ease ordering, if needed. I respect your opinion. Could I get a referral to a clinical pharmacist or genetic counselor? Ultimately, the journey to personalized medicine relies on you becoming your own best advocate. Take an active, engaged, organized role. Think of yourself as the CEO of your own health, with your doctor on your board of directors. Bring information, ask thoughtful questions, ensure your voice is heard. Before visits, get organized. Include your request explicitly. List prescriptions and dosages, over-the-counter drugs, vitamins, and supplements. Note past medications that didn't work or caused reactions. That history strengthens the case for a genetic test. During your appointment, be clear, concise, and kind. Ask for copies of diagnoses and lab reports. Keep all results, especially your pharmacogenomic report. You are the one constant across your care team. Try. I know you have more experience than I do, but I'd like to understand more about... Don't be intimidated. Your experience is essential data. Effective care happens with you. You now understand what pharmacogenomics is, why it matters, and how to talk to your doctor about it. Knowledge is empowering. The most important step is turning that knowledge into action. Your health is your most valuable asset. Proactive steps matter. A pharmacogenomic test can provide a lifetime of value, offering a personalized roadmap to guide medication choices. The time to advocate for this test is now. Before you start a new high-risk medication, before a preventable adverse drug reaction. First, write 1 or 2 sentences explaining why you want this test. Are you about to start chemotherapy? Struggling to find an effective antidepressant? Family history of bad reactions? Second, search for the lab's PgX panel and note the test name and code. Save a screenshot or bookmark the page. Finally, schedule a dedicated visit to discuss your meds and this test.